My daughter is a nursing student, so we'll be the third generation of nurses. And honestly, I would love to shadow you.
Email me.
Wonderful. Wonderful. Hi, I'm Jennifer, and I'm a behavioral health nurse at Boston Children's Hospital.
Hi, I'm Kelly, and I'm a certified pediatric emergency nurse at Boston Children's.
I'm Eddie, and I'm a transplant nurse at Boston Children's Hospital.
Hi, I'm Shelby, and I'm a clinical quality improvement specialist and nurse practitioner at Boston Children's Hospital.
My grandmother was a nurse, and I heard her stories of working in the ICU. She worked all over the country and then ended up in the ED. And she told me all these stories, and I realized that was something maybe I would be good at. And I decided to be a nurse, and it was the best decision I ever made.
My mom is a nurse, and the same, I've got to hear wonderful stories. I started off as a pediatric nurse right out of nursing school, and I worked on a medical surgical unit for a good more than 20 years. I wanted to be a part of the front line of providing care for patients and families going through mental health crisis, and Boston Children's is an integral part of that.
My specialty, I started as a new grad and was like open to anything. I didn't have like any attachment to any specialty. Position open on the transplant floor, and I really liked the patients and the teamwork they had in the transplant floor, so I decided to stick with it. So I've been there for 6 years now.
I work in CEI-QP, which is Clinical Education Informatics, Quality and Professional Practice in Nursing Patient Care Operations. So it's a really long title that basically is focused on how to support nurses at the bedside and how to make it easier for nurses to do their job in a safe, efficient way.
I always wanted to be an emergency nurse. I started inpatient on a med-surg floor, and I was drawn to the chaos, the unexpected nature. You never know what your patient's coming in with. You have to quickly rule out the emergencies, and I loved that. It's a team-based environment, and I really wanted to work there, and the minute I walked in the door, I knew it was the perfect place for me.
How does the ED workflow work?
So in the emergency department, it is completely team-based nursing. So you start in triage, and you're triaged by nurses who would decide your acuity, and from there, you're placed in department. And without teamwork, the department cannot work. So the biggest thing for us is you want to be the best teammate. You want to be the one picking up patients, supporting your teammates or coworkers without them asking. Yeah. It's very different than the inpatient side, but again, very similar at times because you're meeting families, you're trying to figure out what's going on. And at times, I was saying how we don't always build that same rapport as inpatient, but we're able to figure out what the family's there for, what they need, and how we can give them what they need in a small amount of time to make sure that they're safe and that their baby's safe.
As a behavioral health nurse, a very important part of what we do is advocate for our patients, provide feedback and insight to what's working for our patients and their families, what interventions are helpful, where we need to seek more support. And I think about the kids that we're seeing, the trauma that they may have gone through, the crisis their families are feeling, not being able to help them, having them come to stay with us, and setting them up so that when they leave Boston Children's, they have the right supports. I had a patient on the unit that I had cared for in a different health setting, and I went in to welcome this patient, and they started to cry. And truly, I did as well. And it brought me back to all the reasons why I became a nurse. Our patients come to us in those very vulnerable moments, often in crisis. And the impact we have is amazing. It's a privilege. And no words were spoken. It was pretty moving. It really was for me.
One moment in my career that this happened was unexpectedly when I had to float to 10 Mundell, which is the ortho floor. I had a patient who has recently gotten jaw surgery, which this patient was in a lot of pain, had his jaw was really swollen. By the end of the night, he wrote me a letter. I actually have a letter, if you guys want to see it, from the patient. So it says, "Dear Eddie, I wish that I was 100% so I could say all of this to your face, but I just can't talk enough for that. So you have to settle for this letter. all you were so kind to me. Even on paper, I can't seem to express how grateful I am to you and everything you've done for me. You especially were so sweet and heartfelt. Thank you. That was so cute. I still have it. It's so cute.
That's amazing, and it speaks so highly of you as a nurse as well. So you should be proud of that. One thing that I wish people outside the profession had have a better sense of is how much science is behind it, how much nursing involves critical thinking, and it really takes a lot of knowledge base and evidence-based practice to really keep up with all of the moving pieces and all of the developing science. I think that that's an important thing that sometimes can be under-recognized if you're not in the profession.
One of the things I've been most impressed with at Boston Children's, I work with social workers, I work with occupational therapists, psych nurse practitioners, I work with a psychologist, I work with multiple psychiatrists. Everybody brings something to the table. I am amazed every day at the great group of people that I work with. I can't say enough about it. And it makes me want to be the best I can be, always wanting to learn something more and be the best nurse I could be, because everybody is there and we're all there for that patient, for those families with the same goal. It is amazing to feel like you're a part of that team.
Coordinating all of that care is so important. And I think also with the information that nurses have, nurses are spending the most time with the patient at the bedside and know the patient in a different way than some of the other specialties might have the opportunity to, just based on sheer time that you're spending with them. Being able to offer that as part of the communication with other services is so important. And even just the mental load to manage it all is something to be proud of as nurses.
When I shadowed at Boston Children's, I looked at the charge nurses and I wanted to decide, if I work here, is that someone I want to be? And I looked at the charge nurse that day and she was running the place. She was running around. She was helping everyone. She wasn't willing to let anyone fail or anyone fall behind. She was picking everyone up, making sure everyone was okay. Running in circles, yes, but I looked at her and I realized that was someone I wanted to be. I wanted to be that girl in a couple of years and build a department based on people that are fostering growth and good question asking and support, and knowing that no silly question is asked. In that way, I look at her now and I realize that that's the nurse I'm becoming. And that's even more exciting, is knowing that we continue to have nurses that are pushing us to be better, and I'm going to continue to push those next to me to be as good as they are.